welcome everybody to a new 2021 edition of Home Solutions, brought to you by Pro 93 Home Solutions. Welcome everybody. Happy New Year. Hope everybody's doing well. Hope you're staying warm, staying safe, wearing your mask, doing your part. Guys, it's been a crazy few weeks, crazy year. We're hoping 2021 is going to bring some better things and hopefully a vaccine, which is one of the cool things we're going to talk about today. First, a couple housekeeping notes. Got a new format this year. We're going to be a 30-minute show now from Saturdays, 9 to 9:30. You can always catch us right here on Mix 104.1 or 101.3 The Buzz, or you can stream us on the 104.1 app. Maybe you can listen online, and we'll wave to the cameras up there. You can see us on Facebook up there every Saturday morning, 9 o'clock to 9:30. So we're happy about this new format, be able to do some more shows, get some more folks in here to tell you about some of the cool things going on for your home, your garden, and basically just life here in the Cleveland metro area. As always, brought to you by Pro 93 Home Solutions. Folks, anything from handyman to full remodel, we are licensed, bonded, insured here in the state of Tennessee. We would love to help you, whether it's a leaky toilet or you want to put an addition on your house. Maybe you want to redo that garage. Maybe we've been stuck in our house for months and you're tired of looking at those kitchen cabinets and countertops. Maybe you want to put some new flooring in. Give us a call. Remember, we also have our clean team is ready to go for you. For any, right now, everybody wants to be disinfected. They want their houses disinfected. We use cleaners that are 99.9% effective and ready to go. We would love, one of our girls would love to come out and take care of you with our clean team, whether that's commercial, light commercial office, or maybe you want a recurring service there in your home. We would love to work with you. Give us a call, 458-4135, or look us up online, pro93homesolutions.com. Well, now that we got that out of the way, I am very happy today to talk about the guest we have today from Direct Primary Care Associates right here in Cleveland, but also in the Athens, Dalton area, Mr. Brian Fretwell. How you doing today, Brian?
I'm doing great. Thank you for having me.
Listen, healthcare has become, if it wasn't on everybody's mind, it sure is now.
Sure.
COVID has kind of put everything back on the forefront. So we wanted to start this new year, kind of talk about with some other options you might have if you're worried about, how you're going to pay for something, or your insurance hasn't kicked in, or maybe you're self-employed and you're waiting for your marketplace insurance. Whatever that case may be, maybe you've lost some shifts at work, or maybe you've lost your insurance. Folks, there are other ways than the model we have all been taught to get a job, to get good benefits. That's still out there. But if that's not available to you, we need to talk about direct primary care and what you guys do.
Sure.
And so, Brian, just tell us a little bit about what your guys' model, your business model is, and how can people get started?
Sure. Well, direct primary care came out of the rising cost of healthcare.
Yeah.
Namely insurance as really a third-party payer for your health care. What we were seeing is a rise in cost and a decrease really in the care that you get, the time, the services, access. So what we do is cut out the middleman. We don't take any insurance. We do it on a straight monthly membership for a flat fee of $60 a month. No copays, no deductibles. We don't keep anybody out for pre-existing conditions. We see you. We see you in the office for anything that family medicine or primary care would see in the office for.
And correct me if I'm wrong, because Tim loves his sales pitch. Tim from Direct Primary Care but one of the things he has told me, and one of the things that really kind of drew me to the product was you make a phone call. A lot of times you can get same day or next day appointments.
Absolutely. That's actually one of the tenets. It's one of our promises to our patients. One of the things that we really drive home is access. Think of it like the old-fashioned way of medicine. That's really what we're trying to get back to, if you will. So kind of a back to the future kind of thing.
Yeah.
The future part of that is the technology. We're very technology-driven, okay, and as most people are, especially right now with COVID, we're forced into technology, really. We were there before COVID, so we were uniquely, placed in the market to really take care of that. But the other part is access. So when you're a member of ours, you have 24/7 access to your healthcare team. We have a great array of physicians, nurse practitioner, PA, medical assistants that are on the other end of that phone. So when you text, when you call, you're going to get somebody. If you need to be seen, we're going to try to see you that same day, if not within 24 hours. And really, again, moving forward but moving backwards, meaning, the technology driving us forward, a lot of things, and we're conditioned as people that, hey, I need to go in and see you for this rash. With the technology and how we're driven is, well, let me see that rash. Send us a picture of that. Let us take a look at it. Now, this is all done over our HIPAA compliant,
secure.
It's a very secure app that's made specifically for us and for our patients. So it's not just through general text or Facebook or any of the other means of communication.
And so tell me a little bit about you.
Mm-hmm.
I know military vet,
Yes.
and Pro 93, we're a military veteran-owned company,
Awesome.
so we're glad to see. We're always glad to partner with somebody like that. And tell a little bit about how you got to here.
Sure. Well, I grew up in Florida, have family over in Polk County, over in Benton. We would vacation during the summer, and my dad would, bring me up during the fall, and we would bear hunt over in Polk County. Loved the area. Joined the Army, and did not, when it was time to get out, did not want to go back to Florida because all my friends were doing the same old bonehead things they were doing when I left.
Yeah.
So I came up here. I was actually a medic in the Army. Got my EMT, started working actually as an EMT over in Polk County, and worked here in Bradley County, worked my way through paramedic and worked my way through undergrad at UTC.
Nice.
Ended up staying here, spending all of my adult life. Went back to medical school, to PA school down in Fort Lauderdale at Nova Southeastern, and came back up here because this is home for me.
Yeah.
So.
Well, we're glad to have you. And
yeah.
So let's talk about this again. You said this before, and I want to make sure people understand this. $60 a month.
Yes.
$60 a month, and if they're a family, there's a it's $60 per person, but it's there's a max for the family,
Yes.
correct?
Yes. So how we break that down is a monthly membership fee of an individual, and we consider that an adult, 18 years and older, is $60 a month. Children from 2 to 18 is $30 a month. But we do a max of 180, which is basically a family of 4.
Some of us got 4, 5, 6, 7, 8 kids. So we appreciate that. Thank
Absolutely.
you very much. And then there's the only there's no hidden fees. There's an upfront enrollment fee of $60, correct?
Yes.
Now, is that $60 per person, per family? How does that work?
That's actually $60 either for an individual or a family. So,
Gotcha.
So if a family signs up, it's $60. If it's an individual that signs up, it's $60.
And that's a one-time fee, and then they're
Yes.
just paying their $60 per month.
That's correct.
Is there any contract to this?
No contracts whatsoever.
So
we believe in the service, and we believe in the community, if
Yeah.
that makes sense. The value that we try to add back into it for that $60, and I'm sure we're going to talk about that, but the value that we add into it makes it so that the $60 is very palatable because you get your medications, you get your labs, you get all your visits. You don't get anything.
You get your medications and your labs
Absolutely.
are included.
We do. We actually have a list. If you
Yep.
want to visit our website at www.directpca.com, you can see the list of our medications. But think just about any general medications you could take for high blood pressure, cholesterol, diabetes, depression. We even cover antibiotics, eye drops, ointments. We try to get the gambit of medicines that are out there. And in this direct primary care model, what we're trying to do is drive down the cost of healthcare. We believe that the cost of healthcare is astronomical, ridiculous. We pay for a lot and we get a little.
Yes.
And
It's exactly how I feel.
so we feel like a bridge. We
Yeah.
really feel like a bridge. What it means is people feel like they're on the mainland and the island of great care is out there and they just can't seem to get it. We want to be that bridge to get them there.
When I first heard about this, I have a friend who was a member and was just raving about it, and got to the point where I was like, you know what? And then I had called to talk to. I'd actually met Tim at a lunch, and we had talked, and he brought up the idea that it's not just for individuals, that this can be an employee benefit.
Absolutely.
And and even with our situation, we have contractors and subs, but we brought you guys in, and I was amazed at how many of our subs were like, yes. And a lot of them had insurance, just like me. But I'll talk about this as we go today. And I actually, before the show, I said, I don't know what the HIPAA rules are. Am I allowed to talk about my experience? He said, well, I know what I can say. You say whatever you want. So here's what I can tell you. This is hands down the best experience I have ever had going to the doctor as a primary care.
Can I say something? Can I interrupt you?
Yeah.
What you just said is experience, and that's one of the things that we go for.
Yeah.
And I'm sorry for interrupting,
No,
but
ahead.
I get really excited when
Yeah.
somebody says, I had a great experience. When's the last time anybody had a great experience at a doctor's office?
I'm an overweight, middle-aged man, right? Like, I've never enjoyed going to the doctor because you just go in there and they tell you, you know, you need to lose weight, you need to do this. I feel like I've been scolded every time I leave.
Sure.
And Stacy was who I saw here at the Cleveland office. Here's the thing, folks. Like, I'm not. If you're like me right now, I'm busy. You're busy. Even with the pandemic, you're scared about seeing a bunch of people. Like, the last thing I want to go do is sit in a waiting room with other sick people. And I had an 8:30 appointment. I get there. I'm the only patient in the office. When I left, I was out the door before 9:30, a complete physical, blood work. And you know what? She sat down and spent 1 hour with my primary care provider, with Stacy. She talked about what I've done in the past. For me, it was, here's the diets I've tried. Here's when she said, well, have you thought about this? Gave me so much stuff. I told her about some knee pain. She said, well, we need to probably get that checked out. The next day, not only I'm in and out in an hour, back to work, back to my day. I didn't have to sit with anybody else. There wasn't anybody else in there for me to see. The next person was coming in as I was leaving. And it was, you know, and I compare that to the last time I went to my old primary care, who I liked. It was not a personality issue. It wasn't that I thought they were a bad doctor. But I had a 9 o'clock appointment. I got there at 8:45 like they tell you to do. I left there at 11:45, and I saw the doctor for maybe 10 minutes.
Sure.
And I understand the whole insurance model, the fast food medicine, but I feel dumb that I didn't know this was there, because if I'd have known it would have been there, I would have signed up. And to a person, a man or woman that works for us that has used this service, we have gotten nothing but great feedback, which, you know, as an employer and as a business, even these are subcontractors, but you know what? They're happy because we've provided this opportunity for them to be able to get this service. And it has been hands down probably one of the best experiences I've had. And I'm not just saying that because you're here. Anybody that knows me, I will tell you, give them a chance. First of all, there's no contract. There's no reason not to. This is what most of the time it's less than what your copay. I can tell you this right now, and we're up against it. We got to take a break. But I can tell you right now that my membership is only costing me about $30 a month. And I'll tell you why. I was taking an over-the-counter sinus medication because I didn't have sinus and allergy issues till I moved to Tennessee. And there's two kinds of people in Tennessee, people that have allergies and people that are about to. And I was paying $30 a month for an over-the-counter sinus pill. Guess what was included with my membership?
Absolutely.
A prescription for that medication.
So you're talking about the value of medicine.
Yeah.
You actually touched on a couple of things. I'll be real quick. The value is, the very first one, the value proposition for us is your time.
Yes.
What is your time worth? Because your time is just as valuable as ours, and we stick to that. We also stick to a patient-provider relationship. We want to get back to that close relationship, that you have confidence in the person and you have access to the person. The other thing is medications, labs, and all of these other things that we've talked about, is having that value proposition.
Well, listen, we're going to talk more about that value, folks. Real quick, Brian, how can they get a hold of you guys? What's the best contact numbers for them to get a hold of you guys?
You know, we have two offices, one here in Cleveland and one in Athens. Our Athens office phone number is 423-405-1990, and our office here in Cleveland is 423-650-4831. You can call those really at any time, and even when the office is closed, it rings through to one of our cell phones, and we're going to answer or call you right back if you end up getting our voicemail.
Well, listen, we come back. We're going to talk more about this. Don't go away. Stick around. Brian Fretwell here from Direct Primary Care Associates. Folks, you're listening to Home Solutions right here on Mix 104.1 and 101.3 The Buzz. Welcome back, everybody, to Home Solutions. Hope everybody's doing well out there. Happy 2021. If you missed the top of the hour, folks, we're now 30 minutes, 9 to 9:30, so we got 10 or so more minutes here with Mr. Brian Fretwell from Direct Primary Care Associates. He's a PA here in the Cleveland and Athens area. His company is doing amazing things for medicine. I can tell you as a personal patient and for a lot of the folks that work for us, they love his service and what they do. Shout out to Stacy and Mary and all the crew over there. They do a fantastic job. So we've talked a lot. You've talked about what the value proposition is. You've talked about time. One of the things that I found out my first time there was talking about what the steps you guys are very intentional to maintain that value proposition. And one of the ways is on your patient load. Mm-hmm. Talk a little bit about what most people are going to see from a general primary care doctor.
Sure.
That they're used to in the insurance world, the insurance model, and where you guys are, what sets you guys apart there?
Sure. Medical Economics 101 is what somebody sees in one day is 1% of their patient population. So in the fee-for-service model or the insurance model, you have folks seeing 25 to 60 a day sometimes. Yeah. So that means they're responsible for 2,500 to 3,000 to 6,000 patients. So you're getting an average. The national average, you said 10 minutes earlier, yeah. The national average is about 7 minutes, okay?
Yeah.
With us, we limit our providers to 600 patients. So in a day, they should see 6 patients in a day on average, okay? Wow. So we do that very intentionally because we want that access and we want the time. You mentioned your appointment of being an hour. We actually allow our patients to pick their own time they want to come in and pick how much time they want to spend. You can spend 30 minutes, you can spend an hour, you can spend 5 minutes if you want to. It's okay because there are no copays and there are no insurance rules that say that you can only be seen once every 3 days. We can see you 2 or 3 times a day if we want to, or every day until we get you better. Whatever the patient needs, that's what we adjust that to, and we keep our providers to 600 patients, 600 primary care patients.
And understand this, folks. If you it's $60 a month, $30 for your kids, to be able to have just, number one, the convenience of knowing, okay, I'm going to the doctor for an hour. Like I'm legitimately going to go to the doctor for an hour. Like that's my time. Mm-hmm. All right. And the second part is what's included in that isn't just the visit. You know, while I had a general physical, it was time for me to have my annual physical. Decided to go, I was like, hey, well, let's give this a shot. Let's do it. My first appointment. I did the whole pee in a cup. I did the blood work. And here's the thing. Not only did I get my results back faster, normally what would normally happen in years past, I'd go to my primary care doctor. I'd take all these, I'd see the doctor and say, hey, we're going to get some blood and you're going to pee in a cup. See you next time. Any problems? Okay, great. And then I spend the next 2 hours peeing in cups and waiting for somebody to come take my blood. Mm-hmm. And then a week later, I get a letter in the mail. I go in there, get these things, included services for the $60, had my results the next day. And then here's the thing, man. When he talked about technology, I really think, and again, you guys were ahead of the curve with the whole COVID thing. But, Stacy and Mary both called. Mary called. Stacy's messaging me on the secure app. Just asked me how'd it go, how'd the MRI go? Mm-hmm. How'd your follow-up with your orthopedic go? Mm-hmm. What's the game plan?
Right.
Like, I didn't have to call her. She's calling to check on us. And, when you got 5,000 patients, that's probably pretty hard to do. Mm-hmm. But when you've got a limited number, I know when I go in there next time, I don't have to start over. I don't have to remind her who I am. Mm-hmm. And I got to say that you guys, surely you guys, I'm not the only one saying this, or you guys wouldn't be in business. But what has been the response that you've seen here locally in the Cleveland and Athens area?
Very positive for the folks who understand it.
Yeah.
Okay. There's a hurdle there because we're used to it. And I'll tell you, people are used to, okay, I got to go to the doctor. Yeah. So I've got to take off time. I got to do this. The response has been tremendous. I'll give an anecdotal story. We take care of a larger company here in town who has quite a bit of turnover. They have, 20-25% churn.
Yeah.
Okay. We lose very rarely any of those people who leave. They will stay on as patients and pay for themselves. So that
tells you everything you need to know right there.
Yeah. The other part of that too is that and you touched on this, we treat people like family. That really is one of our, if you will, a brand guarantee, a brand promise, is we treat you like family. How would you want to be treated, if you're family? One little anecdotal story I want to put out there too, that we're talking about. Okay, I've got to go to the doctor. Let's move that back to the mother who's sick, okay, and has the 6-year-old child that every year has this sinus infection, or every fall has a flare up of their strep, and they call us or text us. Look, we can't get away. I've got to work. We've got these other responsibilities. We take care of a lot of things telemedicine too. Telemedicine is a part of our rapport. And the thing that we do with our patients, again, long before COVID, people are getting very used to telemedicine now and see the advocacy of their care that happens within it. But that's a part of our plan of what we do too. So,
well, and that's the thing, is that it's different. Mm-hmm. Before COVID, this was so different, and we get conditioned. Well, this is what you do. It's I teach over some college classes over here at Lee, and one of the things I tell my students is, don't be sold just on the thing that you and I probably both grew up the same thing is. You go to high school, you go to college, you try to get a good job, or you go to the military because you're going to get a good job when you get out of the military. And there's these stepping stones so you can get a good job with good benefits, so you can get your watch at 20 years and your retirement and your pension. And just in our lifetimes, that complete model has been blown up. Mm-hmm. And it's crazy to me that even with all the focus on healthcare in the last decade, how the traditional model of how we have exchanged goods and service, money for service, has not. It's still stuck in people because it's so ingrained. Well, that's what you got to do to go to the doctor. Mm-hmm. I caught myself the other day. I was like, I don't know what's going on with my shoulder here. Man, I'm gonna have to call and see when I can get. And then I thought I was like, I don't have to do anything. And I shot a message over, and there you go.
You got it.
And I got an answer, and she's like, do this. It's probably just this. You probably slept on it wrong. And it was, it.
How long did it take for somebody to respond to you?
Less than a half hour.
Yeah.
And here's the thing. The other, my old school method of doing that would be to go to like Google, the Google Medical School. Dr. Google. And if you go to WebMD, everybody, I don't care what you have, it's cancer. You could go and say, I think I have a hangnail. What do I do to treat it? Watch out, it could be finger cancer. Everything in WebMD ends in cancer. Yeah. I don't care what your symptom is. Right. It's a symptom of something that you don't want.
Right.
So just having that opportunity. And real quick, one more time, how can people get a hold of you guys? What's the phone number?
You can give us a call. Again, the Cleveland office is 423-650-4831. Athens, 423-405-1990. If you want to learn more about us and what we can do for individuals and businesses as well, you can go to www.directpca.com.
All right. Well, guess what? We got a few minutes left here before we got to take off, but we're even with our half-hour format, we gotta keep the traditions alive. So today we're gonna talk Mythbusters Healthcare Edition. While I've got you here, I've got some myths that I've curated.
Let's do this.
I've listened to your little $60 a month. I don't know how you're making money, but I know you are, because there's no way you can do this, Brian, because what you're talking about with primary care is way more expensive than traditional health insurance.
That is a huge myth. The huge myth, and I'll tell you why. We're very transparent.
Yeah.
I mean, your listeners out there, do the simple math. 600 patients, $60 a month is groupthink, guys. What we're doing is putting everybody in a pool, and everybody's helping each other out. Community. Yeah. And community is one of the tenets, one of the core values of our company.
Well, how about this? You say that you've got low patient loads, but I know that when I need you, really need you, my doctor, my PA is not going to be available. Mm-hmm.
Myth.
Yeah.
You're
killing me.
So we actually have a care team. All right. So our care team, we're on our phones all the time. Our phones are connected to our patient's phone. You literally can pick up our app, open up our app, text, and you're going to get somebody on our care team, typically in 30 minutes or less.
Well, I know I won't have any access to the tests I need and the labs I need because I'm only paying $60 a month. I know that's more than I've been paying that in copays. I know you can't provide that for that.
That would be a myth as well.
You're killing me.
Yeah. So whatever your copay or whatever your deductible is, you add that into what you've been spending on your medications, labs, all that stuff. We're $720 for a year, and we're going to fall underneath that. Yeah. So it doesn't matter if you have insurance, you have great insurance, you don't have insurance, you have a high deductible insurance, which most companies are going to.
Amen.
We plug right into that huge hole that's being left.
Listen, the question after all this today, folks, is that why haven't you given them a call? Cleveland office, 650-4831. The Athens office, Brian.
405-1990.
And directpca.com. Folks, take charge of your health. Take charge of your finances. Don't get stuck in the same old model, hamster chasing, running the wheel, chasing the cheese, like we've all been taught. I can tell you it works. Call me. Give me a call at Pro93 458-4135. I don't care if you need remodeling or you need some work done in your house. If you just want to talk about my experience with this, I'm an advocate of this because I've used it. It works. It gave me so much more control over not just my finances when it comes to healthcare, but of my healthcare. Brian, thank you for not only being here today, but for bringing direct primary care to us here in this area.
I love it. Thank you so much for having me.
Brother, I appreciate it. Hope you do well. Folks, have a good week. Take care of one another. Stay warm. Keep your mask on. Remember, we're all in this thing together. Let's pray these vaccines work. We got hopefully a few more months of doing the right things, and we can get back to some life as we know it. I just want to go to the movies again, Brian. We love y'all. We'll see you guys next week. You've been listening to Home Solutions right here on Mix 104.1 and 101.3 The Buzz.